So with this, the next step in looking at that standing rotation limitation that we saw in that upper part of the back and also in the hips, this movement here is looking at, can Justin rotate his thoracic spine through 50 degrees of rotation, kind of measuring at an angle. Here is level, and then 90 would be here, so 45 halfway, 50 degrees is here, and we can see that he doesn't quite get to that 50 degree mark on that left side. And then basically, so that's telling me there's an issue. We don't know where it is yet. We don't know if it's an issue with him not knowing how to move through that motion, which would be what we call motor control, which needs very specific exercises and training for him to learn how to use that movement. Or it could be a mobility issue, meaning he just doesn't have the flexibility and the movement in his thoracic spine to allow him to get into that position. So I'm going to test it. Yeah, I'm going to test it passively, meaning he's going to try to stay relaxed and I'm going to move him. And we see again there's a little bit of an improvement, but there's still, I can feel the resistance to the movement. It's not that now all of a sudden I can pull him through an extra 10 or 15 degrees. It's, yeah, he's just not moving anymore. So that's where we'd come in and do some hands-on techniques to loosen up the thoracic spine, and then follow up with some soft tissue work. And then we'd give him a home program where he's doing some exercises to work on the mobility here, which is then going to allow him to be more efficient in his turn and get into a more aggressive position that will allow him to generate more club head speed as he comes down towards the ball. Now that we've found that area of limitation in Justin's mobility or his movement in the thoracic spine, there's an easy way to do what's called a self-mobilization or a self-exercise to help to free up that movement. Oftentimes this is done after a particular hands-on technique is utilized, and those hands-on techniques are very skilled and they're meant to help allow that joint to move more efficiently. So the exercise that he can do at home on his own is that same movement that we tested. It's getting into the lumbar lock position. One hand right in the middle of the table, the other hand in the small of the back. And then basically what you're going to be doing is just rotating to the right side, and you can do 10 times to the right, holding about 5 seconds. And then alternating and doing 10 times to the left. Making sure that you're not letting your body shift and slide. You've got to stay within a box.